To 75% of the general population have experienced some kind of trauma. There is a broad range of events that could be considered as trauma. These include assault, rape, abuse, accidents, criminal victimization, catastrophes, bullying, or natural disasters. Witnessing events or even hearing about such events happening to loved ones can be traumatic. Trauma can be physical or psychological or both. Research confirms that people with developmental disabilities experience more adverse life events. Each individual copes differently with trauma. Some people develop a mental illness entitled post-traumatic stress disorder. Some behaviors that have been noted in the persons with developmental disabilities and post-traumatic stress disorders are aggression, self-mutilation, non-compliance, nightmares. These behaviors are a way that nonverbal and powerless individuals relieve their trauma. Therefore, PTSD is easily misdiagnosed when it comes to people with a dual diagnosis. Misdiagnosis happens quite often because the clinician is not aware of the trauma, so the symptoms are viewed individually instead of as part of a pattern.
On the surface, it appears obvious that the trauma is a prime causative factor of post-traumatic stress disorder. However, it is estimated that only 25% of individuals exposed to trauma develop PTSD, according to Russell and Shaw of Developmental Disabilities Digest 2003. Biopsychosocial approach is the reason why people experience extreme stress without developing this mental illness, while others do suffer from post-traumatic stress disorder. A combination of biological, psychological, and social factors increases the vulnerability of PTSD to people who develop it. These factors are often associated with the lives of people with developmental disabilities, and therefore, biopsychosocial model increase the probability of them developing it after a trauma.
Can be challenging when dealing with past experiences. By talking to a therapist, it can help a person to open up about the experiences they've had rather than keeping it bottled up to themselves. Two types of therapy may include cognitive therapy and prolonged therapy. By a therapist performing cognitive therapy, it allows the person to figure out the main root as to why things may cause distress. Coping strategies with fear, anger, and other thoughts would be included. Blaming yourself is also very common. The therapist would help you understand that by the decision you made was not your fault and you shouldn't feel guilty about the past. Exposure therapy, however, is repeated talks to the therapist about your fears from the past and learning to become less afraid of the past. By being in a relaxed to stressful place, discussing old memories or things that makes a person happier will ease the upcoming conversation of the stressful memories they're talking about. Flooding is also another thing a therapist might use in order to get you to explain all of your bad memories at once to help you learn and feel a little less overwhelmed.
Concept of strategic symptom of PTSD and people with developmental disabilities. Action people do when they are scared. Cause of PTSD, everyone brain work differently, biopsychosocial. Treatment of PTSD, different medicine can be used to treat the same sickness. Supporting people who have the PTSD, way to reduce the person's stress. Way to support the people who have PTSD are keep this person safe, don't make them confront the person associated with PTSD, make sure there is nothing that will trigger a flashback of the event. Let them use their own strategy. During a flashback, remind the person where they are and they tell them they are safe. Have the person to talk about the PTSD. Teach the person how to manage stress. We were experiencing the trauma. Think of remembering a bad dream.